attendees are in listen-only mode.
Welcome, everyone. Thank you for joining Fielding Graduate University and the Worldwide Network for Gender Empowerment, or WNGE, for the webinar series Challenging Structural Inequalities and Disparities in Women's Health, Intersections of Gender, Class, Race, and Nation. I'm Kirsten McGregor, Associate Director for WNGE, and this webinar is the first in a series of 3 Women in Health events. The past decade, WNGE has been working on critical issues around the globe focused on gender empowerment. WNGE is an engaged and diverse ecosystem comprised of global members committed to research, collaboration, and action in support of women's and gender issues. Our mission is to impact change in critical areas including education, poverty, healthcare, environment, violence prevention, equality, and globalization. WNGE is also a UN non-governmental organization, and as an international NGO, we represent global members and contribute to critical issues of concern to the global development agenda. Today, our webinar event is entitled The Feminization of Pandemics, Women Face Ebola Triple Jeopardy. Our agenda follows 3 general segments. First, an introduction to our panelists, which is then followed by 3 presentations, and we'll then have a moderated panel discussion with Q&A. We won't be addressing questions during the presentation, but please submit your questions, and we'll be sure to answer them during the last segment. So, without further ado, I will now be passing the mic over to our moderator, who will be addressing today's discussion. We have Dr. Margot Okazawa-Ray. Good morning, Margot. I'm handing the presentation over to you.
Thank you very much. Good morning, everyone, and thank you especially to our panelists. I just want to let people know that Mr. Obi Sise had to go out on an emergency, so Yabom Gilpin Jackson will be taking over his segment. Anyway, I think you can see from their bios what an illustrious group we have today, and Yabom is one of our own, a graduate of the HOD program. So we're in very good hands. And what I'll do is just go ahead and have Yabom get started. And again, we ask you all to, pass your questions in the question section, and I'll be fielding those. So, and we'll be ending promptly at 1, just so you know. So Yabom, please take it away.
Hi, good morning, everyone. As I've been introduced, my name is Yabom Gilpin Jackson. For this first segment and my initial comments for the next 10 to 15 minutes or so are actually a presentation that was submitted by Obi Sise, a colleague of mine who is actually heading the situational room in Freetown, Sierra Leone, who are leading the Ebola response. He's been called away this morning because of an imminent crisis. In the moment, the Vice President of Sierra Leone is under quarantine because of this very topic, and a number of his staffers have just started showing symptoms of Ebola, and so Obi had to move away to go address that situation. Obi is a risk and economic analyst who goes between the UK and Sierra Leone. And as early as last summer in the UK, he was on the BBC a number of times speaking to a lot of the trends and forecasting a lot of the realities that have actually occurred with the Ebola response, and had been calling very early for some of the solutions that are proving to be working at the moment. And so after speaking about it on air a few times, he actually accepted the position and went over to be on the ground working to implement the ideas that he had. So I am going to walk through the slides that he submitted. I had a quick conversation with him, and I'll just provide the highlights from our discussion, and hopefully can answer the questions that you have regarding this as we go through. So if the other thing to note is that because he is right in Freetown in Sierra Leone on the ground, the numbers and trends that you will see here shortly represent as up to date as possible the numbers and the situation on the ground in Freetown, Sierra Leone. And as you know, Freetown, Sierra Leone is one of 3 countries in the West African region where Ebola, that are at the epicenter of the Ebola outbreak in this round. So it's Sierra Leone, Liberia, and Guinea. I know that in one of the previous fielding webinars, the focus was on the response in Liberia, and today Fatou and I are both originally from Sierra Leone, so the focus is on the Ebola situation in Sierra Leone. So on to the next slide. What this slide shows is the principles and operating model that is working in Sierra Leone at the moment. I believe when the outbreak started, a lot of the response, given how quickly the virus began to spread, was a bit uncoordinated. At this point, this operational model is in play, and as Obi says, and as the numbers are showing, this seems to be working. And what the model is that there was a recognition that there needs to be national coordination, but at the same time that the majority of the response needs to be localized and driven within communities at the district level. So the model is that at the national level, what you see on the top in the bluish box, depending on what you can see on your screen, the NERC is the National Ebola Response Center. And that is the body where OBCC works. That body takes care of all of the command, control, immediate response and emergency response around the outbreak, and sort of sets the structure for the response. They are driven, of course, on the other side of that top area of the quadrant you're looking at, by the pillars of the Ministry of Health Services. And those pillars and services that the Ministry of Health are providing are all of the technical infrastructure to implement the response. So that is your lab services, your surveillance services, your contact tracing, your epidemiologists. All of those are sort of supported by the Ministry of Health Services, working together with the National Ebola Response Center. They are all working on a model where they are driving those services down to the district's Ebola response centers. So that bottom box, that sort of pink shaded, receives all of the support from the national level, and they are also replicated at the district level, all of the support services and clinical support services to drive the response on the ground. So what you see is a parallel structure that is completely district-led with strong regional collaboration. So on to the next slide. What we see is sort of the sort of turns in the Ebola outbreak that have evolved and sort of parallel this move from a national, fairly uncoordinated response to a more coordinated national and district response. Back in July, August, in the summer of 2014 last year, the state of emergency was announced. The outbreak had actually started 2 or 3 months prior. But by July, it was clear that the outbreak was there. It was in Sierra Leone and spreading. So the state of emergency was announced, followed very quickly by, quarantines and restrictions on movement, school closures, and just time for people to reflect and think through what the response was going to look like. In September, that culminated in literally a house-to-house search and education campaign. So the whole basically country was shut down. There were staffers and volunteers and nonprofits and interested parties literally going door to door as much as they could. In some areas they didn't reach everyone, but basically door to door with Ebola education. At this point, it was clear that there wasn't a lot of clarity on the ground about the nature of the Ebola viral disease, about how it spreads, and about what the response needed to be. So that house-to-house Ebola talk, as it says here, host-to-host Ebola talk, is the Creole term for that, was basically for a local education so that people were aware of what was needed and what was required, and especially around the issue of safe burials. Traditionally, burial practices involved a lot of contact and had a lot of ritual that were really important to people locally. And so that campaign helped spread the word about what was required in this Ebola situation. What also occurred was in that house-to-house search, I know following that those teams ended up finding also a lot of sick people that were in homes with families who didn't quite know what to do, where to take their family members, scared to take their family members to local hospitals on the fears that they'll never see them again. Because locally, what people, the reason a lot of people were giving for holding back in terms of giving up and taking their family members to hospitals was that, well, we know other people did and they never see their loved ones again. So they did end up finding a lot of people in homes already affected with the virus and also even some dead bodies. And so that campaign helped surface some of the fears that people were holding locally. By November, December, the district Ebola response centers were established on the recognition that the response has to be local, not national. December to now being February and in the current state, there has been a number of surges. Up to about December, a lot of the spread of the virus had been in the districts and in the rural areas. From about December, there was an initial surge in the western area in Freetown, and very recently there's been another slight surge as well. So if we go on to the next slide, in spite of the ups and downs and the surges and the numbers, what we are seeing is that the regionalized and the combined with the local response is working. There has been, as you can see by this trend chart with the numbers, that there has been a steep decline in December and January overall with the epidemic, flattened out in February, and there has been a slight surge over the past week. So I'll speak to that again in closing today, later on when I'm closing, in my closing comments, but in some ways this is not unexpected. It is what the team locally on the ground, I know one of Obi's comments is they were expecting sort of a bumpy ride to the end, and you'll see another chart about that, where there will be a steep decline and then sort of an up and down trend until they get to zero overall with the viral spread. So on to the next slide. In spite of the sort of bumpy ride to the end and the up and down there, in the sort of big picture, the good news is that over the past 6 weeks, the areas where the virus is concentrated are clear, and they're doing a lot of work in those particular districts to continue to limit spread, work with those affected, continue to ensure safe burials, and overall just contain the virus and stop the spread to the areas that are now close to Ebola free. There are 4 districts that have not reported any confirmed cases in the last 6 weeks. 3 have been declared Ebola free over the past 70 days, and we know it's 42 days is the mark, which is 2 viral incubation cycles for a region to be declared Ebola free. So 70 days is really, really good. And then up to 47% of cases recently are in a specific area north of the country, about 30% in sort of the western urban Freetown area, and 23% just sort of north of that as well. So on to the next slide. One of the areas in the pillars earlier that I mentioned is contact tracing. So overall, with sort of beating Ebola, what has been known is that there's four things really around fighting the virus, and that is the education and local response, which I've spoken to in the Sierra Leone case already, contact tracing being the second one, ensuring there's specialized Ebola treatment procedures and centers and all of those clinical procedures that the pillars support, and ensuring safe burials. So I've mentioned a little bit about how all of those are playing out in Sierra Leone, but contact tracing is the area where they've seen some significant progress. There's been some struggle in the past 6 to 7 weeks around the cluster. I showed earlier on the map that there's 3 or 4 specific clusters in the districts, and one of those clusters north of the country there's been some decline in contact tracing, and partly why they believe the spread has continued in that area. And I'll just say that area is near and dear to my heart because that's actually where my father is originally from. So also for me, very personal, with a lot of family in that area, even as we speak. So on to the next slide. The suspect case numbers, so these are numbers of suspected cases, have remained relatively constant. As confirmed cases are declining, suspect cases have remained constant, and this, in terms of the overall trend, is also good news. Overall, pointing to the fact that the trend is going towards zero, and the virus is being contained. And a note here, as I said earlier, that the current crisis that OB got called off for would tally with suspect cases, because those vice president staffers that are now showing symptoms will probably be flagged as suspect cases until their lab results are returned, confirming whether or not they have contracted the virus. So on to the next slide. This is the image talking about the expected road to the end being a bit of a bumpy ride with small spikes in cases. And literally this week, I believe it was as early as Monday, I will confirm that in a moment. I think it was 21 or 31 cases that were confirmed on Monday after quite a bit of a lull. So, around the continent and elsewhere in previous outbreaks, this is the usual expected trend. So that's what the team on the ground at the NERC, the National Ebola Response Center, and the district centers are working with, knowing that they will expect some of those spikes. So on to the next slide. Here's the picture. So what I've given you is sort of the current trends, the current state where we are in terms of overall cases trending to zero. But the real place that we're sitting in right now is that bit of a transition. So there is some good news. It is not all good news until there are no more cases of Ebola in West Africa, not just in Sierra Leone, but also in Liberia and Guinea. Those countries share such porous borders. It's critical that all 3 of those countries get to zero for this epidemic to be declared over, for this outbreak of Ebola to be declared finished. In the meantime, we are also already at that point where we need to start thinking about the transition, the long-term healthcare recovery, and the economic and social recovery that is going to be required. There's a lot already out that we know about the long-term impact. Schools have still closed. The education sector has struggled. Same with the health system, as you can imagine, has been overwhelmed. Economically, the country has been basically at standstill. Sierra Leone was projected among the fastest growing economies in 2013, and we're going to be much further from that right now as a result of this outbreak. So lots to do, and long-term response. We need to already start thinking about the long-term response and what needs to be done as we sort of sit in this transition of up and down cases. So to the next slide. The priorities then to getting to zero is strengthening the surveillance and contact tracing. As I said earlier, the situation in Port Loko is that has broken down a little bit and is why the virus is spreading. And we know from, I know from some of what I've heard, anecdotally, I don't know if this is confirmed, is that the surge in Port Loko actually started back again because of someone affected in, I believe, Freetown, who went back into Port Loko and wasn't traced. And so that's a priority right now on the ground, and just ongoing social mobilization, social awareness and consciousness, and deeper community engagement, continuing on with that education and community engagement, and helping at the district level and local level people to be engaged in the response and in what is required to get to zero in their communities. And so on the last slide here, the priorities for transition are you know, also working on some of the other impacts that structurally the Ebola teams have been working with. So transitioning also at the National Ebola Response Center and the district's Ebola Response Centers from sort of an emergency disaster response mindset to that capacity building mindset that I was talking about. And so that was it from the on-the-ground experience and data. I'll just pass it on to Fatou now to talk about the women's health impact of the situation.
Before Fatou starts, I'd just like to draw people's attention to two things. One is really thinking about the impact of the history of the Civil War, both in Sierra Leone and Liberia, and how Guinea was, you know, the borders among those three countries, and the longer-term impacts of those civil wars on the infrastructure. Then the second kind of macro global point is thinking about the ways in which the structural adjustment programs and policies that were implemented in the two countries have negatively impacted on creating and building and shoring up any infrastructure that was there. So I think it's important to put Obi/Yabom's points in those two contexts as well. And so now let's have Fatou Waris, thank you very much for coming, and please take it away, talking specifically about the gendered way this.
Hello? Okay, all right. Good morning, everyone, and it's a good evening from my part of the world. Thank you for having me with you today. My presentation is really going to focus on the impact of Ebola on sexual reproductive health services in Sierra Leone, particularly focusing on women, on maternal and newborn health. The presentation, the slides you're about to see, don't really necessarily link directly to the talk I'm about to give, but they are going to give an overview of the landscape of maternal and newborn health services in Sierra Leone, and I'll talk through how Ebola has gravely impacted that for a lot of women in our country. So in terms of, just to contextualize Sierra Leone a little bit, between 2008 and 2013, Sierra Leone had made major strides in improving quality healthcare services for mothers and babies, or just improving quality healthcare services for women in general, from accessing family planning to accessing quality maternal and newborn health services. And some of the improvements or some of the success stories were the introduction of the free healthcare bill that was passed in April of 2010, which was quite revolutionary for Sierra Leone. And the free healthcare initiative basically mandates that free healthcare for pregnant women, lactating mothers, newborns, and children under 5, basically addressing the economic barriers that women were initially facing to accessing quality care. Mamaye, the organization which I'll tell you a little bit more about that I work for, was part of a consortium of other local and international NGOs that really, and community members and activists that lobbied to increase budget allocation to the healthcare services. So in 2012, which was a really strategic year, it was the election time in Sierra Leone, we were able to increase allocation of healthcare services from 7.4% in 2012 to 10.5% in 2013. Just to note that Sierra Leone has yet to meet its Abuja Declaration target of 15% of its national budget towards the health sector, but that was a big success story for the country at that time. Another success is that almost 100% reach across the country for women to attend at least one antenatal visit by a skilled health attendant. Prior to 2010, women were just not going to health facilities at all for antenatal care. And of course, prior to Ebola, we had doubled facility-based delivery. And part of the work that we do in women's health, particularly for maternal and newborn health, is we truly believe that women can survive or greatly increase their chances at survival when they deliver within a health facility. Now, right before we officially announced Ebola in Sierra Leone, the WHO, the World Health Organization, had ranked Sierra Leone in March, I believe, as still having one of the highest or one of the worst maternal mortality rates in the world, despite all of these successes that I've outlined. And so we knew as the activists or the health community that a lot more work had to be done in order to increase the budget allocation to health. We needed to institute more sustainable measures within the health facilities in order to facilitate emergency obstetric and neonatal services for the country. Basically meaning we need to be able to ensure that our clinics are safe for more women to deliver so we can save more lives at community level and in hard to reach places. Now, Sierra Leone's healthcare system prior to Ebola was already struggling, was already quite weak, and the Ebola outbreak has just exacerbated this. So a couple of things to consider in terms of Ebola in the context of health services in Sierra Leone. There is actually no biological sex difference regarding the vulnerability of the Ebola virus in terms of, affecting women or men. However, when it comes to women, there are social, cultural, and healthcare related factors that increase risk for women. These factors we see at the moment are the Ebola-related discriminatory factors. Many health facilities between July and October completely closed down. Women could not access health care, from family planning to antenatal visits, or at least we're finding it very difficult to access health care. And I personally have at least 3 to 4 women, family friends, or just people that I would meet that would call and ask for help in order to access a health facility. And this was because there was a lack of protocols. There was very little infection prevention, disease control training across any health facility in Sierra Leone. And what that ended up doing was creating fear amongst health workers and patients to access or to open or to keep open health facilities. With the lack of infection prevention and control policies or safeguards not in place, that meant that pregnant women that did go to deliver in health facilities or try to access health facilities were more prone to major infections, sepsis, and therefore further decreasing their chances at survival. Another barrier was the lack of proper management structures, which really resulted and really affected healthcare services for everyone in Sierra Leone, particularly women, was that there was a rerouting of all resources, healthcare resources, to Ebola, therefore limiting resources available for not only managing the disease, but health in general. Health workers were really fearful of Ebola transmission because they didn't feel like they were supported or had measures in place in order to protect themselves. There was a lack of training, as I've already mentioned, and particularly when it comes to maternal health care, they were completely scared when obstetric hemorrhage situations happen, meaning a woman goes to deliver, major bleeding occurs. Health workers were really afraid to be in that situation for fear of lack of protection. So in summary, women in Sierra Leone have really come to bear the greater burden of this disease. And not only due to barriers in accessing quality sexual reproductive healthcare services across the entire continuum of healthcare in Sierra Leone, but because of our social and cultural role within society as well. So that means women are, primary caregivers in Sierra Leone, within our society, within our culture. And of course, within the healthcare professional, women constitute a higher percentage as nurses and midwives. And one of the issues that we've been having so far, and one of the biggest modes of conversation right now that's happening at the social mobilization pillar. If you just to go back to Obi's slide when he showed us just how the Ebola response, we've got NUC, and right next to NUC, that orange box, Mamaye, many local NGOs sit within these pillars, and under social mobilization, we've been trying to basically address women's sexual transmission, meaning if a man is positive and survives Ebola, if he tests negative in his blood, and Ebola still exists after 90 days in his semen and other fluids, and that puts his partner, women in sexual relationship in a sexually vulnerable situation because they won't use a condom, or women have to submit to their partners, and so that has also been a real concern. So in terms of just after outlining all of those, what does this really mean for women in Sierra Leone during this pandemic? It's meant that the average Sierra Leonean woman who has very little choice but to use government health facilities, will not and has not been able to receive quality of care. And this has resulted because of lack of knowledge, lack of healthcare services, and misconceptions surrounding Ebola. What has really happened during the Ebola outbreak in Sierra Leone is that as social mobilizers, as agencies, as the government, we really have not done a good enough job at women-targeted messaging that addresses women's concerns, sexual health, pregnancy, and social support. Our messaging has not been targeted enough, and our services have not been targeted enough to support women within our context. And it really has meant that we still have not been prioritizing the well-being of women and young girls. And we also see, and it's quite anecdotal right now. We don't have the evidence to back it up, but there's been a huge spike in teenage pregnancy. The First Lady of Sierra Leone has spoken about that. There's been an increase in sexual violence amongst young girls in Sierra Leone. Now, a recent research done by the UN Women and Statistics Sierra Leone showed that 56.7% of all Ebola positive cases are women. And so we see that women are still incredibly disproportionately affected by the virus. So what is currently happening to address this systematic, this disproportionality? Last week, actually, there's been a collaborative effort between the Ministry of Social Welfare, Gender and Children's Affairs, UN Women, Oxfam, and Statistics Sierra Leone. And they've led the development of the multi-sector gender impact assessment of the Ebola virus disease. It's a really long term, but essentially what this means is we're finally seeing that we need to create a national comprehensive data that outlines the impact of Ebola from a gender perspective so that we can better address and provide targeted gender policy responses to the Ebola outbreak, okay? And the Minister of Social Welfare, Gender and Children's Affairs has really stressed the importance of the surveys or surveys like this because they will basically be able to better gauge the impact Ebola has on gender and social dimensions and the differential impact on women, boys and girls, which is really important. Now, in terms of the way forward, we've always been saying this as Mamaya, as an organization, as people working on the ground. Greater attention before Ebola and our weakened health system had to be placed on the health of women and newborn and children in Sierra Leone. This means that when we're getting past the transition period and going into post-Ebola efforts, we must put in place sustainable investments in the provision of healthcare services in order to ensure that positive strides are made within the healthcare system. And some of the success stories that we've attained are not erased. But yet Sierra Leone is really a long way away from addressing these parameters. We have a lot of work to do. We have a lot of rebuilding to do. We have to go back we have to go back in building trust between community and healthcare service providers, community and clinics. And government and the development partners have to institute sustainable measures for the provision of things like emergency obstetric and neonatal care. That means every healthcare facility in Sierra Leone post-Ebola must be able to address emergency care for mothers and babies. Yeah? So just to summarize that, for me, I work for Mamaya, which is an organization that works in 6 African countries and focuses on the survival of mothers and babies. We focus on generating evidence to be able to have an evidence targeted advocacy that really empowers not only leaders at national level and policymakers, but more importantly, communities, from men to traditional leaders to mommy queens, female leaders, to be able to know the status of their healthcare facilities in the country and to be able to effectively advocate for positive change within their communities. And that's how we feel accountability and change can occur within the healthcare system in Sierra Leone. And Mamaya, over the course of the Ebola outbreak, has been generating a lot of data, a lot of evidence to basically outline just how prepared health facilities are within the country to handle the Ebola response. And our data has shown, especially in October, we released the first set of Ebola readiness assessments, and we saw that over 80% of the health facilities across the country were not prepared to address health issues, particularly those of women. So that's changing, but we continue to advocate and to push and work with development partners, but our communities to be able to kind of ask for their own change. So yeah, that's really it from my end. And I've also added there are a couple of links and additional resources that can be available to you to have a more thorough look at just the situation for women and young and newborns in Sierra Leone. So thank you.
Hi, thank you, Fatou. Can you just say what Mamaya means or signifies, please? That's a question from the audience.
Right. So Mamaya is actually the face of the more technical. It's a campaign. So Mamaya, we work in 6 countries. It means mother. It means survival. It means being able to prioritize the African woman. Mamaya is a campaign that's actually supported by DFID and managed by Options Health Consultancy. Evidence for Action is where all the technical work is done. That's where all the evidence generation occurs. And Mamaya is the face of all of that. Is a face of the African woman and her right to access quality care across the 6 countries we're working.
Okay, thank you.
You're welcome.
Yeah, Bohm?
Hi. Okay, and so to close, just a few comments directed specifically for those of us in the diaspora, those of us with interest in Africa and African affairs and development on the continent, whatever our connection is to it, and overall from speaking from the place of just our common and shared humanity. I want to make a few quick points. The first one being that earlier I spoke about the response to Ebola and eliminating the spread of the virus had to do with four things. The first of those being education at the local level. Well, my experience from here, currently based in Canada, is that education applies globally. So on to the next slide. I think what we saw as the virus began to spread and was in news, etc., is that there was a real sense of panic and not a lot of knowledge and accurate knowledge about what the virus is, how it spreads, and what the potential impacts of the virus are. So. Bruce Aylward, who is an epidemiologist and the Assistant Director General with WHO in charge of polio and emergency clusters, recently did a TED Talk in December on beating Ebola, he called it, and basically subtitled Humanity versus Ebola and how we can win the war against Ebola. And he talked about the panic and the escalating alarm and the impact of that being an increased isolation of the countries that were affected by Ebola. And I can say from living in Canada that as we speak, all immigration entry to the countries affected is currently closed. So whether people had immigration applications in progress or in process or not, those files have all been put on hold. So there's no entry to people from Sierra Leone, Guinea, or Liberia, whether or not you're affected by the virus. And so to me, what that signifies is the need for education, awareness, and a shaping of public perceptions and understandings from the place of accurate evidence and knowledge of what the viral disease is, how it spreads, and how people who are affected can be supported in ways that not only helps them, but helps take away from the isolation, the stigmatization that is starting to be the experience of people from those three countries, whether they're on the ground or outside the continent. So, here in the West, what I began to see is on social media images, slogans, and campaigns, such as the image you're seeing of the map of Africa with Sierra Leone, Guinea, and Liberia highlighted, and the rest of the continent labeled no Ebola. And I think this was symptomatic of the isolation and stigmatization people were starting to experience, and people saying, well, wait a second, I'm not from those three countries. Well, of course, for those of us from those three countries, this was really hard to see. I know that the WHO had a campaign out saying, isolate people, quarantine people, do not isolate countries. And that was being said when flights stopped going in and airlines started discontinuing flights to the region. There were many people speaking out about, well, how is help and support and the immediate emergency response support and supplies needed in the region going to get in when we know how to control for the spread of infections when people are going in. So just to note here that at the end of the day, the need for education is global and is needed on this, whether you're on the continent or out of the continent at the moment. As I said earlier, those of us from those three countries, it was really hard to see maps like this going up. So if you go to the next slide, some of the response from Sierra Leoneans that I know was this map: I am Sierra Leonean, not a virus. Because if you live on this side, all of a sudden it became not very simple to answer the question where you're originally from, because the assumption was when I say Sierra Leone, the conversation becomes becomes about Ebola, and then of course for those of us from Sierra Leone and Liberia, this is the next wave where a decade or so ago, the concern was as soon as I say I'm from Sierra Leone, I'm associated with the conflict and the war. Of course, valid, those things were happening. But the reality is it's the nature of the response and how we engage, no matter where you're from or where you originate into this conversation. It's how we engage in these conversations in a way that provides that education and provides a sense of moving forward and sort of collective humanity around it, I think is the piece that makes a difference for those of us who, by default, being born there, are constantly engaged in those conversations. I know for me, the ones that leave me hopeful are the ones where people are engaged from the place of what can we learn, what can we do, what's the response, and not from the place of you know, what is the potential that the virus will continue to spread, not from the perspective of panic and alarm, but from the perspective of education. So onto this slide, the next point is about complacency. Bruce Aylward, in that same TED Talk, spoke about two things that he saw as being the current deterrents to ending the virus. One being complacency, the other one being fatigue. And for me, those two things go together. Complacency, and on this side of the world, outside of Africa, is the tendency to desensitization, to move on to the next crisis, to the next issue, and sort of a sense of, okay, that's done in the public view, now we're on to the next crisis. And for all of the reasons that have already been raised, back when I was going through OB's slides, you saw that we're in this transition period. It is absolutely important that we keep focus on and off the continent and continue to speak out, continue to educate, continue to advocate for what the situation is, and to call for people not to be complacent. You know, it's easy. This image, I love. This is an actual real image from Sierra Leone, sadly. And it's just the idea of you're in the situation so much, you're seeing the danger in front of you, and you're desensitized to it. And I think that's the risk that we run outside of the continent, is just to see it as something outside of ourselves that doesn't matter. Onto the next slide, sort of a similar imagery on the next slide of lots that could be changed, lots that could be fixed with simple measures, but you're in it all the time, and so it's easy to skip over it. Same with the next slide, looking at things like infrastructure and roads and sanitation and traffic. I mean, this might seem divorced from Ebola, but as we know from some of the underground experiences, I'm thinking also of the last webinar and the team from Liberia talking about how much road and infrastructure, and if you look at this image, crowding has impacted the spread of the virus, understandably. And so these are all the things, when we become desensitized to them, they compound and escalate and create on top of each other and slow down the potential for the development and progress of these countries. And so we can't turn a blind eye and stop. So what I want to move to in closing on the next slide is really a call for all of us, wherever you locate again in this conversation, on or off the continent, for long-term capacity building, focus and partnerships. On the screen, what you can see again is a real picture from Sierra Leone, one of the organizations that I am on the board for, a nonprofit that is really focused on the long-term educational needs on the continent, focused on youth education, youth mobilization, and community development projects. One of the campaigns this was actually early in 2014, before some of the volunteer team left because of the Ebola spread. Showing partnerships between the US and Canada and Sierra Leone. That was an educational project, because this is not the era of one-time aid and one-time support for Africa and anywhere else in the developing world is done. What we need now is long-term capacity building and partnerships that develop locally people's capacity to address their own issues. We'll always need support in the global economy, both there and on this side of the world, but the capacity for people to have their humanity intact and their dignity intact, and given the privilege and choice to have voice in their own solutions, is absolutely paramount. So on to the next slide. Just the call that this is not just about today, this is for generations. This is for the children of Sierra Leone. This is for ensuring that when we're all no longer here, we leave behind a place where girls and boys and school children and our children and grandchildren after us can say that a lot was done to build capacity in a way that leaves a better world for them. So as I said in a blog that I wrote earlier last year, in response to some of the panic and sort of misinformation that was spreading from my perspective here in North America and beyond, I wrote a blog post that that spread quite fast. And one of the things that I said in that article, if you go on to the next slide, is that this is not a sub-story. Onto the next slide. It is not a sub-story. It is not a pity party. This is a call for action. And what you see here is an image of me with the Sierra Leonean community in Vancouver, in British Columbia, who were out for a rally and went to broadcasting stations and lobbied politicians that day that this is not a sub-story. This is a call for action because people affected by Ebola need hope, not pity. They need reassurance that the world cares. I'm just going to end very quickly by saying what makes this comment very real to me is a number of years ago I did research and interviewed post-war survivors. As Margot has said, Sierra Leone is a post-war environment, and so I interviewed post-war survivors in Sierra Leone and the rest of Africa, and I interviewed a woman who was there for the genocide in Rwanda. And her comment, she is now a Canadian citizen and doing phenomenal work here in the education sector, both in Canada and back home for her in Rwanda. And she said, I won't quote her exactly, but she paraphrased that one of her biggest shocks when she moved to Canada was the mass lack of awareness and education about what had happened in Rwanda and how much people didn't know. And for her, especially given General Delaire's connection to the situation, she was really surprised. So she said she made it a practice of asking people, where were you in 94 during this time? What were you doing? And she said one of the most common responses was, oh, that was Grey Cup year. We were watching the Grey Cup. And how that has landed for her, the need for social consciousness, global social consciousness and awareness, and for us not to turn blind eyes to other things that are happening around the globe, no matter what corner of the globe it is. That's not to say we shouldn't enjoy the privileges and the peace and security and all of the benefits we have of living outside of places where there's crisis. But it does say that we need to be aware, we need to be educated, and we need to do whatever we can do, however small our part is, to make a difference. Because when one part of this world is suffering, the rest of the world is. Like that same woman said, she said, now I'm here, I'm contributing here. There are Rwanda genocide survivors all over the world. The impact of their traumatization is being spread all over the world. Same with this pandemic. The impact of Ebola will be with all of us, not just those in the region. Thank you.
Thank you, Fatou and Yabom. Unfortunately, it looks like we've lost Margot. However, we do have a few questions coming in right now. And so I'll just field them to Fatou and Yabom. One of the questions is, this has been great regarding institutional response. However, what about the community level? What about the fact that a large part of a woman's identity culture is being a caregiver and taking care of the burial process? How do we balance being respectful of the woman's identity and appropriate health measures?
Okay, should I take that?
Yes.
Kristen?
Yes.
It's a very difficult balancing act, and it's a really good question, because how do we remain respectful, but at the same time reassert that we are in a state of emergency and we do want to get over Ebola, and we do want to ensure that women, people on the ground are safe. And to be honest, it comes back to just smart, repetitive social mobilization, and I don't really like the word sensitization, but that's really what it is. It's being able to take the cultural tenets at community level and respect them. I'll give you an example. a very good friend of mine, his brother passed away, and it was a very painful process, and he's Muslim, and the burial team has been doing an amazing job in Sierra Leone. They were able to go, pick up the body, and still bring in the imam, other faith leaders, the family to see the body, pray for the body, and then take the body to the cemetery. So it's being able to ensure that the family feels as though they can see the body, they can be part of the burial process, they can go to the gravesite and know where their family member is located, to ensure that women feel like their voices are being heard, that they're very much a part of the process. And many times we've been successful in doing that. But it's like you said, it's about balancing that. How do we ensure that we respect our traditional practices, but at the same time always repeat and reassert that these are not normal times in Sierra Leone and lives are at stake. So it's just one of those things.
Great, thank you. Yabom, do you have anything to add to that? Yabom?
I would just add that, yes, hi, I'm here.
Great.
Can you hear me?
Yes, we can.
Yes.
Can you hear? Yes. So I would just add that, part of what in sort of the overview from the National Ebola Response Center is that they moved to district Ebola response centers specifically for some of these local reasons and some of these reasons, and the knowledge that the solutions for these sort of issues that border on cultural and socio-economic factors need to be addressed within communities. And so those district Ebola response centers are also working with local community leaders and encouraging people at the local level, giving them the information and speaking with them and encouraging them around some of the solutions for things like honoring burial practices and attending to women as caregivers and working with women around in the cause of caregiving, also protecting themselves, in terms of when people in the household become sick, measures that they can quickly take. So it is an ongoing process. It's not a simple solution or a simple answer, but I know that over time, I believe, in addition to what Fatu said, that is what's making the difference. It's that ongoing communication and local engagement for people to be part of what the solutions can be. I don't think we can provide any prescriptive answers to that, and sort of all of the cultural nuances are different district to district across that region. So it has to be a local response.
Thank you, Yabom. Now, similar in vein is a question from David Willis. He says, capacity building is so important. My question is about the impact on cultural practices, how what has happened has changed local culture, rituals, and so on. So what's changed? What practices have required modification or simply a suspension of various practices based on this pandemic?
I can take that to start. Yeah, and Fatu can speak more to on the ground and the specifics of what is changing right now. But I would just say you don't come back from something like this. I think everything changes. If I go back to the post-war experience, I was there during the sort of climax of the Civil War and left in the immediate aftermath of that. I know that when the first time I went back after that, in my eyes, everything had changed. Everything from how people engage, everything from social discourse and how people speak, rural urban migration and the surge that we saw then. I think the whole fabric of the social structure changes. One of my favorite quotes when I write about Africa in the context of globalization is from Saminan, a social and educational African psychologist, and he wrote ages ago, I don't remember the date, that you know what, Africa is at a hybrid of cultures at the moment, and with globalization, we as much as we continue to work with and honor local cultures and practices, and absolutely, I think we can all agree there's no losing that core fabric, but we are at a hybrid of cultures, and everything has already changed in terms of, because of how porous the world is at the moment. I don't think you come back from something like Ebola. I think burial practices will change somewhat, have already changed, and that one to me is the one that feels the most like a suspension. People will go back, I think, for the most part, to honoring their practices. But I think in the subtext, something does shift and has already shifted. Over to you, Fatu.
I mean, you've pretty much summed it up quite eloquently, and just being in, you know, I'm currently not in Freetown, but I've been there for the last 6-7 months, and to live there has been one of the, it is so emotionally draining. It begins to take a toll on you across all economic social stratas, and like Yabon says, the very fabric and our interact of Freetown, of Sierra Leone, what happens across the country has completely changed. We are a very touching peoples, and you just begin to see how, even in how we communicate with one another, what we say to one another, how we interact with one another has completely changed. The dynamics between community and district level to national level, and how we all interact, and how the policies influence across all levels has completely changed. I just, for me, I mean, Gabon, you've pretty much summed it up. But in terms of also what's really happened in Sierra Leone, for me, the most amazing thing is to see just at community level how people are working together, just how the diaspora has fed into supporting Sierra Leoneans, the type of programs, the type of people that have come back to be able to effect change at community level. Just how, even though we don't interact, there's a lack of physical touch, but there is still so much support going on in the country, despite the misconceptions, despite the challenges, despite the things that don't work, and the spikes and the up and down, and the deaths. We've mourned and lost so many of our great doctors and health workers in the country. There's quite a bit of loss happening in Sierra Leone right now. But at the same time, it's really given way also to a lot of youth engagement, to a lot of youth leadership, to a lot of community mobilization, to a lot of innovative ideas. And to me, that's really exciting. And I think what would be really great to see is have a lot more of those stories teased out for the rest of the world to see local ownership and what that looks like in Sierra Leone and at community level.
Well, I think that ends it on a very powerful note. And I'd like to say that, oh, well, we have one more one more question. So powerful comment, powerful commentary, Fatu and Yabom. What more can be done to better support capacity building and the impact of the diaspora, hybridization, Creoleized responses? You have given us hope for the situation. And with that, with your last two responses, then we will probably not take any more questions unless there are any more flowing in.
Okay. Yeah, well,
I think a general response for me for that is it depends on what your strength is, your background, your contribution can be. I think it's looking for the places where you can contribute, where you're passionate, where you can look for the organizations that are engaged in work that is capacity building. I know that for me, it was looking through and saying, what are the organizations, what are the ways that I can engage? And so that I chose where I thought I could make the best contribution, through speaking, through education, through the university connections that I have, and locally with an organization that I believe was addressing one of the core issues. So it's seen where in the spectrum there is so much that needs to be done, from education to social to economic, like every sector has been impacted in Sierra Leone. And so finding ways to partner with people locally on the ground and letting people come up with their own solutions is the only thing I can say about that. As Fatu has said, there is so much going on, and I know that the ones that are being, the initiatives that are proving most successful are those where this is about mutual learning and mutual looking into the situation together and saying, how can we best support, but how can you who own this situation on the ground, what do you need, and partnering in those ways. And I think that's where I'll end my comments.
Yeah, it's really, really important that I think for me, one of the biggest things has just been just to see how the world responded to the Ebola outbreak, and how, we're looked at, the fear, the paranoia, the feeling like just a diseased body, and navigating just trying to travel, and just wondering how allies across countries in Africa and in the West can help support or can help influence at their own national level stringent travel policies to those of us that are here. I mean, I went to school in Canada. I lived in Canada for 8 years, and unlike my other family members, I'm not Canadian, but being able to know that I can't even go back to Canada, or the choices or the borders were locked to me, was something that was really upsetting. So I think from that end, how do we in our respective homes and countries, hold our own national policies or responses to Ebola outbreak in West Africa? How do we influence our own politicians and our own decision makers at that level, so that they're positively contributing to what's happening in Sierra Leone? And in terms of how do we give back to Sierra Leone, completely agree with Yabom. Support local doers, movers, and shakers. The knowledge, attitudes, perception study, CAP, was done by a local NGO, Focus 1000. They are responsible for what we know about Ebola right now. They took the initiative, no one was willing to fund them, and they went out, and they are now working with all the big international partners to be able to provide sound and real life data on the status in Sierra Leone, and they're a local NGO. And so to be able to just kind of filter through the plethora of international NGOs that are doing good work, but being able to support local content, local movements, is something that for me would be really, really amazing, based on your strength and your interest and where you feel your contribution will be most warranted.
All right, thank you. Thank you both, Yabom and Fatou, for excellent presentations today. And thank you to our audience for participating in this presentation. A recording of this webinar will be available in the next couple of days, and we'll post it on our website, Facebook, and YouTube. It'll also be pushed out to you via GoToWebinar. So wherever you are in the world, have a great day or a relaxing evening, and we will see you next month for the second webinar in this series entitled Gender Equity, Reproductive Health, Infant Mortality, and Sex Selection. All right. Goodbye, everyone.
Goodbye, everyone.
Bye.